This is a very effective treatment on the lumbar spine. Patients tend to report feelings of easing of pain, increase in range of motion, increase in feeling of well-being. We'll take the contact medium here and spread it around a little bit. I'm right over the centre of the lumbar spine. I'll switch the treatment on as I spread the contact medium out here. We've got plenty of time to spread the contact medium out. I've gone for more contact medium really than I need. I don't want it to dry out. And if I get any hot spots, I can just start working around those areas. You'll probably find that the muscles down both sides of the spine become warm first, before the bones in the centre do. There's no problem going over the bones. Again, there's a mole here on the lumbar spine. I'm going to avoid that really. I don't want to just be running straight over that mole. The smaller ones I'm not too worried about. The bigger ones though, I really don't want to be running too much over. So we'll keep the treatment head moving round in small circles here. There's always a balance on the lumbar spine between doing more and more minutes and spreading the heat out more and more, or doing shorter bursts of time for smaller areas, say one side and then the other. And I suppose that debate will just keep going on. It will come down to, I think, what you prefer to do. Obviously, if there's only pain on one side of the lumbar spine, it's a pretty easy choice. You just do that area and you do a smaller area. But if it's the whole of the lumbar spine, then you might want to choose more minutes. But remember, there will come a point where you just can't put enough heat in. So if you choose 15-20 minutes, it can be very difficult to warm up an area that large if you're doing 1 minute per treatment head size. Now this is a long treatment, and so what I'll do is I'll cut to the end and we'll have a look at the thermal images again. So today I'm going to be treating the back using the Tecarpuls from Enraf Nonius. We'll go into lower back pain. You'll see the machine has started at level 10, which is its highest level. That'll preload the heat for 7 minutes. I like to go 1 minute per treatment head size, so 7 minutes won't be the worst amount of treatment. We'll start with that. Cutting to the perspective of the therapist here, we'll take the earthing electrode, just apply a little bit of contact medium to it. I'll spread out that contact medium and then put that underneath the patient. You can put it underneath the patient anywhere. I've just chosen to put it underneath the patient's tummy. I need to apply some contact medium to the back, but before I do that, we'll just bring the thermal camera in and have a look and see what the temperature is on the lumbar spine. During this treatment, we're looking to increase the temperature in the lumbar spine. Starting at level 10, we should increase it quite well. So we'll bring the thermal camera in here and we'll just have a look and see what the temperature is. Get it into focus here. You'll see that we're looking at about 32, 33 degrees, 32.5 in the centre there. So towards the end of the treatment now, you can see that the lumbar spine has gone a bit red. It's developed a bit of erythema. I'll take the treatment head off there and we'll bring the camera back in. We were sat originally at 32, 33 degrees. And if we have a look now on the thermal camera, you can probably see we're sat at 34 degrees. So we've had a temperature increase, but because it's such a large area, it is only a smaller temperature increase than you would have got if you'd have just done a smaller area and concentrated on the muscle.